If you live in Los Angeles, you've heard about the problem of patient dumping. Who can forget the grainy surveillance video of the frail, elderly homeless woman climbing out of a taxi cab to wander the streets of Skid Row wearing only a hospital gown and slippers? So to fix the problem, City Council made homeless patient dumping a crime, but without an appropriate discharge location, many hospitals, they just continue to dump. Others keep their homeless patients 4 days longer than necessary at a cost of about $3,000 a day, and then shift those uncompensated costs to you and me. Good evening, my name is Kelly Bruno, and I am a social worker and the Chief Operating Officer for the National Health Foundation. For over 40 years, NHF has been bridging gaps in healthcare like the one I just described. We identify emergent healthcare needs and then address them with innovative solutions like our recuperative care centers. NHF centers are a cost-effective way to provide needed aftercare and support to homeless patients discharged from the hospital. Yes, there are similar programs, but what makes our program unique is its sustainable business model. After we secure funding for the first 12 months, all future operations are sustained through revenues generated from partnering hospitals. So in other words, after the first year, we require no government support and no philanthropic support. In addition, we utilize small vacant motels for our facilities to avoid unnecessary capital expenses. Of all the programs that exist today, there are 2 that operate with this innovative business model, and NHF, we operate them both. So, how does it work? With a simple one-page form, hospitals refer a homeless patient to our program. We then arrange for transportation, medications, and instructions for follow-up care. Once in our care, a nurse monitors the patient's condition, a social worker develops a discharge plan, and a director communicates with the hospital until the medical issues are resolved. Since 2008, over 2,000 homeless men and women have healed in our recuperative care centers. But what we are most proud of is that when they leave, we have successfully connected 44% of them to housing and transitioned them back into the community. Oh, and the 63 participating hospitals? Well, they avoided over $12 million in unnecessary costs, costs that will not be passed on to you or me through inflated hospital expenses. So based on our success and a needs assessment, we are excited to be opening our 3rd center and have already secured over 75% of the funding needed to sustain it. Tonight, we are seeking your support to get the remaining $250,000. So if you have a heart for the homeless and $250,000, I would like to meet you in the lobby. If you have a portion of $250,000, I would like to meet you in the lobby. If you know anyone who can help us, I would like to meet you in the lobby. Thank you, and I'll see you in the lobby.